Tens of thousands of healthcare professionals in hospitals across the country are already taking the next step in verified HIPAA compliance with Identity Finder for Healthcare. The following use case is based upon the actual experience of several Identity Finder customers, though we've changed the names. Intrasystem Regional Healthcare, or IRH, is a regional hospital system of about 12 hospitals, several urgent care centers, home care and hospice, lab services, radiology, and occupational health clinics. Big City Medical Center is a 750-bed hospital within the IRH network. IRH has a centralized health information system which is accessible to each of its medical centers, hospitals, clinics, and other locations. Each location has access only to appropriate patient records. All IRH locations, including Big City Medical Center, have well-established procedures and training that do not allow low-level employees such as interns, nurses, and billing staff to save or export PHI from the centralized health information system. Low-level employees have read-only access, while medical practitioners and administrators may read, write, copy, and export patient data. IRH administrators and other super users have the greatest access to patient data in the health information system. As is typical in many organizations, big city medical practitioners, such as surgeons, doctors, physicians, and pharmacists, as well as administrative managers, such as billing managers, supervising radiologists, and managing nurses, are allowed nearly unlimited access to subsets of PHI, and often export various PHI fields from the health information system to conduct analysis and issue reports. Most of these reports are never properly deleted from laptops, email systems, or file servers. These copies pose a risk to Big City Medical Center and IRH because the more insecure places PHI is stored, the more likely it is to be lost, stolen, hacked, or inadvertently sold to third parties when the computer is decommissioned. Fortunately, healthcare security professionals can prevent data loss and verify HIPAA compliance. There are two complementary strategies to prevent data loss. The first strategy is network monitoring and blocking. These products are also known as data in motion data loss prevention. The second is data discovery or data at rest DLP. IRH and Big City Medical Center evaluated a popular data in motion DLP product and found several problems. While the data in motion product was supposed to simply scan network traffic for sensitive information and block prohibited information as it traveled over the network and email, it did not empower doctors to clean the sensitive data at its source. Instead of shredding information, the data in motion product simply continued to block the target data without ever addressing the core issue. Information should be encrypted, permanently erased, redacted, or quarantined. Repeatedly blocking medical practitioners from using patient data frustrated them and created new security risks when doctors bypassed the blocks. And bypassing data in motion monitoring was easy. For example, some data in motion DLP products monitor email, but not USB thumb drives. Others may monitor HTTP traffic, but not FTP traffic. Some will search Word documents, but ignore documents users have disguised by changing the file extension. Data in motion DLP products can never monitor all network risks. IRH administrators also found that the data in motion product had a very high false positive result rate. Because data in motion products need to be fast, they trade off accuracy. In practice, this means that legitimate emails or other network traffic was blocked at a higher rate, and some unauthorized traffic got through, causing frustration and an overload of false positive results for network administrators. One of the biggest problems in the industry is wasting security professionals' time by forcing them to analyze mountains of false positive results. Although data in motion products may be useful in organizations with a high risk of email breaches, reported email breaches are rare. In fact, in 2011, 0 healthcare industry leaks reported to Health and Human Services were caused by accidental data in motion disclosures. Because a data at rest DLP solution better met their needs, IRH and Big City Medical Center evaluated Identity Finder for Healthcare for 30 days. Identity Finder performed in-depth searches of PHI where it is stored, allowing Big City Medical Center to stop leaks at their sources. Identity Finder in particular is able to search every file and email on all desktops and network servers and display those locations with sensitive data. You can even view the information in the preview pane without digging through your file system. Administrators and managers use the Identity Finder reports to improve patient security without impinging on patient care. Medical practitioners evaluated the results of an Identity Finder search and chose a context-specific response. Doctors could secure it by permanently shredding it, or if an administrator needed to keep a text file but wished to redact the sensitive information inside it, she could click the scrub button. Identity Finder automatically redacts sensitive information, such as social security numbers or medical record numbers, in this case, replacing them with X's. Or medical practitioners may quarantine or encrypt the file. Protecting PHI has never been easier. Because Identity Finder searches and cleans all patient data at its source, Word documents, uploaded files, information copied to a USB drive, and email attachments were clear of sensitive data. In addition, IRH and Big City Medical Center administrators were able to rest easier, knowing that the hospital wouldn't suffer a data breach should a cleaned computer ever be lost, stolen, or hacked. Identity Finder has an extremely low false positive result rate due to its advanced validation algorithms. High accuracy means you save time and money that could be better spent caring for patients. For example, rather than matching any 9-digit number as a Social Security number, Identity Finder uses Social Security Administration data combined with keyword searches, file type specific analysis, and proprietary analysis to drastically reduce false positive results. Full regular expression and dictionary support permits searching for MRNs, ICD-9, ICD-10, CPT, and other medical codes. IRH and Big City Medical Center administrators were also pleased that Identity Finder automatically creates a robust PHI data inventory that demonstrated system-wide HIPAA compliance and gap analysis. The Identity Finder console created detailed reports for technologists and dashboard analysis for decision makers. Identity Finder is flexible and may be configured to meet the needs of almost any network topology. IRH administrators decided to implement Identity Finder in 2 phases, but your implementation may be customized. In both phases, IRH centrally managed their deployment using the Identity Finder DLP Enterprise Console and received centralized reporting from all devices through their entire hospital network. In the first phase, they installed Identity Finder on each laptop, desktop, PC, Mac, or server belonging to superusers. The end users or the DLP Enterprise Console configured the endpoints, and the end users were empowered to run their own scans and clean their own systems. The results of Identity Finder searches and end users' actions were reported back to the DLP Enterprise Console and IRH administrators. Most administrators were surprised at the amount of PHI Identity Finder discovered on their systems. For example, one surgeon found 7-year-old reports with Social Security numbers in her Microsoft Outlook sent items. Identity Finder alerted a physician to PDF files saved in his My Documents folder, which contained ICD-9 codes and other patient data. A hospital administrator found years of weekly patient reports stored on his laptop. After the end of Phase 1, administrators and medical practitioners discussed the findings of the first phase and jointly wrote administratively and technologically appropriate controls for exported PHI. During Phase 2, they implemented their policies by deploying Identity Finder agentlessly on all computers. Identity Finder will search remote web, database, file, and email servers using agentless searching. From a single administrative workstation, you can remotely search other desktops, file servers, or any network device with a hard drive without installing Identity Finder on those machines. Identity Finder can even run invisibly in the background without slowing down computers. As always, the agentless search policies may be set, monitored, and controlled by the centralized DLP Enterprise Console. We understand that your organization will have unique needs, which is why Identity Finder's architecture is flexible and may be configured for any number of hybrid deployment scenarios. To download Identity Finder's white paper, visit identityfinder.com. Verify your HIPAA compliance today by running Identity Finder for free. Call 888-244-3790 and let Identity Finder save you time and money so you can get back to patient care.